As we all age, which by the way is the good news that we're getting older, one of the most common things we hear from women in particular is, what do I do about this terrible looking sag in my neck? Now, sags in the neck can come in different forms. In some women, even when they're quite young, they can have a fullness underneath the chin. In this area here, we call it a submental region, which just means beneath the chin. This can be due to excess fat, and sometimes this is something that just runs in the family. Now, the good news is, for women who are a little bit on the younger side, let's say anything up to 40 or 50, and sometimes even to 60, we can perform some liposuction to suction away that extra fat, and if the skin has enough tone, it'll contract, and very nicely you'll improve that angle and create a sharper angle in the jaw-neck line. However, other things are also happening. We have muscles in our neck. These are called the platysma, which means flat muscles. And as you know, if you think about all the other muscles in your body, as we age, they start to sag a little bit. And that can create some of this banding or cording that we see in the neck. Now, usually if that's happening, what we need to do is make a little incision underneath the chin and tighten those muscles up. That's called a submentoplasty or platysmoplasty. And plasty in this case just means shaping of the muscle. And this creates a nice platform or foundation, just like tightening up a hammock that you might have at your cottage, so we can build a new foundation for the face. Now finally, what else can be happening? Well, of course, the skin starts to sag as well as it loses its elasticity and its tone. And so we have to remove the skin. In most patients who have a lot of redundant skin or a wattle here, we treat that as part of the face and neck lift, and so that skin is lifted up and removed out to the sides along with the facelift. Once in a while in patients, and usually this is in the more senior person, we can do a direct excision of the extra skin, the muscle, and the fat in the midline. But if we do that, it does leave a fine incision here. And so it's important to speak to us and say, what is it that bothers us or bothers you the most? And then what we can do is determine which will be the best procedure for you. But the good news is, for almost everyone, we can improve very significantly that significant neck wattle and give you a more rejuvenated look.